drmaas.com video blog. I got a question today which was a very good one, and I wanted to get it addressed, which was, what is the difference between some of these mini lifts or mid-face lifts and a regular facelift? And it is extremely confusing. I'll tell you that I speak in a number of meetings. I'm on panels about facelifting and aging face all the time, and even sitting at a table of expert panelists, there's a lot of discussion and dissension about what terms mean what in this field. The original term facelift really described a lower facelift, the lower two-thirds of the face being addressed, whether it was done with a skin technique or a skin and underlying connective tissue technique or a deep plane technique. Really, that was the area that was addressed. When we started getting into this era of mini lifts, a lot of this is about marketing. The original mini facelift, which is very similar to what's been described with an S lift and a quick lift and a style lift and all these different lifts that are out there, was described in 1908 by a French surgeon named Passot, who did a small incision in front of the ear. This is published, and I have the paper from the original facelift procedure. A small incision was done right along the ear here, small amount of skin elevated and pulled back, with or without tightening the underlying tissue, and then there's a little stitch line there. In the very typical approach in some of these so-called 1-hour lifts, that's exactly what's done. The outcomes are variable, can help a little bit, but it's certainly not a long-lasting result. Some mini lifts, on the other hand, are quality mini lifts, and when I divide them up into two basic categories. There's a mini lift of the face, which addresses the cheek, neck, and jawline area. The cheek and jawline area. And then there's a mini lift of the neck, which addresses just the neck area, and to some extent will improve the jawline. In my procedures, a mini lift of the face is done with the underlying thick connective tissue. We're using the Maas layer then, the subcutaneous musculoaponeurotic system, and I'm elevating the skin extensively in this area, and may even go into the temporal region depending on what the patients want. I'm elevating the skin in this region using a local anesthesia, sometimes with sedation or deep sleep anesthesia if the patient desires. Then I'm taking that Maas layer, restoring the contour to this region of the face, especially the jawline, the marionette line, and the lower part of the nasolabial fold. And then I'm elevating and bringing the skin back in a gentle sort of way so it doesn't look pulled or windswept, hiding the incisions behind the cartilage here called the tragus, behind the hairline as long as the patient's hairline is okay, and just stopping right behind the ear. That would be the strategy for a mini lift of the face. With a mini lift of the neck, it's very similar, that we're hiding the incisions back behind the ear and into the hairline. I do liposuction through a tiny little incision under the chin, and if there are bands here, we'll address them. That's called platysmoplasty. And then from that point, I'm elevating this loose skin on each side and gently pulling back and bringing the contour back to the neck. It's a lot like what you'd see with a neck lift if you stood in the mirror and pulled this back slightly. So I encourage our patients, if they want to know what a mini lift looks like, to get in the mirror and pull back on the neck. That's a mini lift of the neck. If they want to know what a mini facelift looks like, gentle tension on the lower part of the face here shows them the result. So there's a lot of confusion out there amongst patients and doctors, and I think it's not an unusual question. Something that we certainly like to address over the long term is to be able to standardize this language so that everybody understood it. Thanks for visiting drmaas.com video blog, and look to see you back. Send your questions.